In this video, here's what we'll cover. Why fighting your thoughts backfires. How ACT differs from CBT. The 6 core processes of ACT. The passengers on the bus. What the evidence shows and who ACT helps. You have tried everything to quiet the worry. You have challenged the anxious thought. You have told yourself to think positively. You have pushed the self-doubt and the low mood away, again and again. And somehow, the harder you push, the louder it all gets. If that is your experience, I want you to hear something clearly, right at the start. This is not a personal failing. It is actually the predictable result of a strategy that feels completely natural, but that the research tells us tends to backfire. We cannot suppress our thoughts simply by trying to suppress them. The famous instruction, "Don't think of a white bear," always produces a white bear. The more effort we pour into controlling our inner experiences, the more space those experiences take up in our minds. In my practice at Potentialz Unlimited in Bella Vista, I meet many people who are exhausted by exactly this kind of struggle. They have been trying to fix their thoughts for years, and they are ready for a genuinely different approach. That is the problem that acceptance and commitment therapy, or ACT, was designed to address. So let me show you how ACT differs from CBT. This is the clearest way to understand it, and it is not about one being better than the other. CBT works mainly by changing the content of your thoughts. If you notice the automatic thought, "I am going to fail," CBT asks, "Is that accurate? What is the evidence? What would a more balanced thought be?" The aim is to replace unhelpful thinking with more realistic thinking. ACT takes a different path. It does not primarily try to change what you think. It tries to change your relationship to what you think. The ACT question is not, "Is this thought true?" It is responding to this thought the way I do actually helping me live the life I want? That difference matters. For someone whose distress is driven by clearly distorted thinking, challenging those thoughts can be powerful. But for someone who has faced real losses and real difficulties, or who has been doing that cognitive work for years and still feels stuck, ACT offers a different door. It was developed by the psychologist Stephen Hayes across the 1980s and 1990s, and it has been researched extensively ever since. That work rests on 6 core processes, which together build what we call psychological flexibility. Let me walk you through them in plain language. The first is acceptance. This does not mean resignation or approval. It means allowing difficult thoughts and feelings to be present without fighting them or letting them run your behavior. It is an active choice, because the energy you spend fighting them is not serving you. The second is cognitive diffusion. This means creating a little distance between you and your thoughts, so you notice them as passing mental events rather than facts. Instead of, "I am worthless," you learn to notice, "I am having the thought that I am worthless." One image I often use with clients is leaves on a stream. Picture your thoughts as leaves drifting past on the water. You notice each one, and you let it float by. You are not the leaves. You are the person watching from the bank. The third is present moment awareness. This is the ACT version of mindfulness, gently bringing your attention back to what is happening now, rather than being lost in regret about the past or dread about the future. The fourth is self as context, sometimes called the observing self. It is the part of you that notices all your experiences but is not defined by any of them. The fifth is values clarification. Values are your chosen directions, the things that give your life meaning, not goals you tick off, but ongoing directions, like being a caring parent, or living with integrity. The question is simply, what do I want my life to be about? And the sixth is committed action, taking real, sustained steps in the direction of those values, even while difficult thoughts and feelings are along for the ride. The metaphor I return to most is passengers on the bus. Imagine you are driving a bus, and your fears and self-doubts are the passengers. Some of them are loud and rude. They tell you to turn around, to change direction, to pull over. You have 2 choices. You can turn around and argue with them, while the bus drifts off the road. Or you can keep your eyes ahead, drive toward what matters to you, and let them make their noise in the back. They are still there, but they are not driving. So what does the evidence show, and who does ACT tend to help? Its research base has grown quickly. As of last year, more than 1,300 randomized controlled trials support ACT across anxiety, depression, chronic pain, OCD, and workplace stress. It is recognized by the American Psychological Association and included in the Australian Psychological Society's Register of Evidence-Based Interventions. In my experience, ACT can be especially helpful when thought challenging has started to feel like more struggle, for chronic conditions that are unlikely to fully disappear, and for burnout, where the gap between how you are living and what matters most has grown wide. Often I blend ACT and CBT together, tailored to the person in front of me. If you are tired of fighting your own mind, please know there is another way, one that builds flexibility rather than more struggle. You can read the full guide, or book an appointment at our Bella Vista practice, using the links in the description below. Before you go, here's a quick recap of what we covered. Why fighting your thoughts backfires. How ACT differs from CBT. The 6 core processes of ACT. The passengers on the bus. What the evidence shows and who ACT helps.